Hello, my name is Dr. Carlo Carandang, and I'm a psychiatrist. Today, I will talk about the negative cycle of post-traumatic stress disorder, also known as PTSD. PTSD occurs after you have experienced a major trauma. Symptoms of post-traumatic stress disorder include re-experiencing the traumatic event, which could come in the form of nightmares or flashbacks about the trauma. You also become hypervigilant and you start to scan the environment for any danger frequently. So, PTSD is a major anxiety disorder that occurs after you experience a major trauma. So, here's an example of a negative cycle of PTSD. Here you have the trigger, which would be any reminder of the trauma. So maybe you were involved in a motor vehicle accident, and maybe you were driving past the accident scene, and then this in turn triggers the re-experiencing of the trauma. So what happens is the trigger, you start to re-experience the trauma via flashbacks and nightmares as if the trauma were reoccurring. So it might be bringing you back to the actual accident and you going through the actual accident scene, and that playing through your mind through flashbacks or through nightmares. And then these thoughts and images about the past trauma then induce anxiety. So in addition to anxiety and terror, you start to have the physical sensations of adrenaline response, otherwise known as the fight or flight response. And then what happens is that you re-experience the feelings, the anxiety that you felt when you were going through the trauma. So the anxiety is very uncomfortable. So the anxiety makes you avoid, and then it forces you to escape the situation, avoid future triggers. Then you start to scan the environment for danger, and you become hypervigilant. You're always on guard. So the avoidance maintains the belief that the trauma is still occurring, and this continues the vicious negative cycle of PTSD. So let's go through each one of the items of the negative cycle of PTSD. So suppose you have post-traumatic stress disorder, and then you have a trigger, which is any reminder of the trauma. So in this case, maybe you had passed by the scene of the accident that you were involved in. So the situation induces thoughts, images, and memories about the event. So then you start to re-experience the trauma in the forms of flashbacks. So flashbacks are like you're seeing a movie play out right in front of you. And this flashback or this movie playing out in front of you looks like the actual scene of the trauma that's occurring right before your eyes. You may also re-experience the trauma later when you go to sleep in the form of nightmares, in which it feels like you are, again, in the midst of the trauma that's reoccurring. So it feels when you're being triggered by a situation from a previous trauma, then the thoughts, images, and memories that this triggers, it feels as if the trauma is reoccurring. So you're seeing it in the form of either flashbacks or nightmares. So these thoughts and memories about the past trauma induce anxiety. So you feel anxious, you have terror, you have the physical effects of the adrenaline response, otherwise known as the fight or flight response. So you can have physical effects such as shortness of breath, you might have chest pains, muscle tension, sweating, increased heart rate, and you also may be re-experiencing the feelings that you had surrounding the trauma. So not only are you re-experiencing the trauma in the form of maybe what you're seeing and hearing, but you're also re-experiencing the trauma in terms of how you felt at the time of the trauma. So this could be very terrifying because when you are exposed to life-threatening trauma, then you are afraid for your life. So you are really, really anxious then. And this re-experiencing also involves re-experiencing the feeling you felt as if your life was being threatened. So the anxiety makes you avoid, and this is also known as safety behaviors. So the behaviors you engage in include avoiding the situation which triggered the response in the first place, and you try to avoid future triggers. So you'll try to avoid the scene of the accident in the future, or you try to not talk about any accidents with anyone in the future because this might trigger you. So then you also start to scan the environment for any danger that may occur, that may or may not occur, and you become hypervigilant and on guard for that danger that may or may not occur, but at all times. So although the avoidant behaviors decrease your anxiety over the short term, the behaviors actually maintain your overall anxiety from the feared stimulus. So the avoidance then maintains the belief that the trauma is still occurring. This then continues the vicious negative cycle. Your feared stimulus induces thoughts, which induces anxiety, which then compels you to avoid. So instead of just exposing yourself to the trigger and finding out nothing bad will occur, you avoid the trigger, and this maintains your belief that the trauma is still occurring. So with avoidance, you never get to find out that the anxiety will go away naturally if you just stay with your trigger. So the solution is cognitive behavioral therapy, otherwise known as CBT. So CBT helps to break the negative cycle of PTSD by changing how you think and what you do. It's difficult to change the way you feel, so the focus is on changing the way you think and the way you do things. For more information and help on PTSD and other anxiety problems, please visit AnxietyBoss.com. Thank you for listening. I'm Dr. Carlo Carandang.